Hey guys, it's Jen. I know I'm making another video today. I've been posting a lot over the last week, but my surgery date is in a couple weeks, and I'm so excited, and I'm so excited that you guys are here following my story and sharing it. And I can already tell people are telling me that my videos are helping them, and that means so much to me. Like, that's exactly what I want to do. So I'm so glad. And again, with the t-shirts and the donations, thank you guys so much for all you guys have been doing. We really appreciate it. But I'm going to go into like what type of surgery, what type of mastectomy am I going to get? I think it's really important to know kind of all the details of what your surgery consists of. So I went as far as, looking up pictures and even looking up videos on YouTube of the surgery I'm going to get. I know people think that's weird, but that's just me. I like to be prepared. I like to know as much as possible. When I go under that anesthesia, I want to know exactly what they're going to do, what to expect. So that's just me as a person. Everyone's different. But I'm going to go into detail of what my surgery is going to consist of as much as I can. I don't know, all the specifics of it, but I'm going to at least give you guys a general idea of what they're going to be doing to me so you can see, before surgery, after surgery. I'll show you my dressings and all that stuff. So first of all, there are two different ways you can get the surgery done. One, which doesn't really happen that often. I hear some people get it done, but a lot of people get the breast tissue out and put in the implants all at once. Now, I heard different things. I've heard people get it done and they have awesome results. They have no complications. But then I also know people and heard stories that they really don't recommend it being done that way. I guess it's just your preference and what your surgeon is comfortable doing. In my case, they're going to do the surgery in two parts. The first part, what I'm doing on November 4th is two doctors are involved, and it's Dr. Polikoff, which is the oncology breast care specialist. She's also a breast surgeon. So she's going to go in and she's going to make an incision underneath my breast, and she is the one who's going to remove the breast tissue. Everything else is staying, just the breast tissue is going to be removed. So I'm going to have two small incisions underneath my breast. And when she's done, she's going to check for bleeding. If they do see bleeding, they go ahead and cauterize it, and they make sure everything is good. Then she's done with her part of the surgery, and then the plastic surgeon comes in and she does her part. Now, I'm not getting the implants in right away. My surgeon recommends that I get what are called expanders first, and this is just to really stretch the muscle, stretch the skin, really fill out that area that's going to be holding in that heavy implant, so there's less stress on it down the long run. That's how I see what the purpose of the expander is, and I know my mom had them during her surgery, and I've seen them used in other people having the surgery and read reviews, and they work very well. So that's what I decided to do, and my surgeon recommended that's best for me. So I actually printed out some pictures that I found online, because I know when I get to talking and describing stuff, it can get a little confusing. So I really think that these pictures are going to make it easier to understand. And I want you guys to know and be educated about everything. I think this is like the most important part, is the process of the surgery and what they're going to be doing. So after the breast tissue is removed and the plastic surgeon comes in, they're going to remove part of the breast muscle, and the expander actually goes underneath the muscle, and then they sew the muscle over the expander, and then they close up the breast, and that's basically it. So I do have a picture here. I hope the glare isn't too bad, but I have a picture here of what an expander looks like. It's basically a deflated implant with a little port here with a magnet inside. Now this is going to be behind the breast muscle and sewn up. So after surgery, this is what's going to be in my breast. I actually have another picture here, and after they put this in, I'm going to have 2 drains coming out. They're called Jackson Pratt drains or JP drains. They look like little torpedoes, and that's just to drain all the excess fluid from the surgery to make the healing process faster. And I'm going to have those drains in for about 7 to 10 days. And once they start draining less and less to nothing, then I get those taken out. So that's really what to expect when I'm done with surgery. I'm going to have a bandage around my chest with only the expanders in and with the 2 drains on the side. So I'll make another video after surgery showing you guys that because I think it's important. But I know some people get kind of squeamish when they see that type of stuff. So I'll give you guys a heads up when I do that. But that's down the road from now. But after the expanders are in, and it takes about 4 to 6 weeks to heal, after I'm done healing, through that process, they are going to fill the implants. I have to go probably every week or every other week, and they put a little bit of saline in each time I go to the office. I just go right to the plastic surgeon's office, and they do the procedure right in there. It's a really simple procedure. So obviously this is covered up by skin, and this is a magnet. So what they do is they take a little butterfly needle, just one like you would see with a blood draw, and they actually go ahead and puncture the skin into the port, and that's where they fill with a syringe a little bit of saline at a time, because your muscle and the skin is stretching, so you don't want to do it too much because it's going to be uncomfortable. But your doctor or surgeon will know how much to put in if you go this route. That's totally in their hands, in their decision. But once it's in, they obviously have to find the magnet. So they have this cool little detector thing that they put on, and it tells you where the magnet is. And then that's where they go through the skin, and then they fill it up. So I actually have a picture here. Hope you guys can see it without the glare, but this kind of gives you a better picture of what the expander is in the filling process. So this is going to be me right here after surgery. You can see that the expander is right here, the blue, and this dark red line going down is the muscle, and that tan is the skin. So it just sits there, it's deflated. So then when I go to the office on this part, there's the butterfly needle. Here is the tubing, and then you have a syringe out here with the saline, and they put the butterfly needle into the port, and that goes into the implant, and she goes and puts in the saline. And you can see how by just a little bit it gets bigger and bigger, and everything stretches. You can see the red in front of the expander, which is the muscle, and then the tan part over here, which is the skin. So everything is starting to fill out. They only do it a little bit by little bit because they don't want to like pump it and you stretch everything at once. That is going to be so uncomfortable and not safe at all. So that's why it takes a couple months, because you have to go every week, every other so often. They only put so much saline in at a time. And it is sore. Imagine, your muscle is constantly being stretched and constantly holding up these expanders filled with fluid all the time. So they have to get used to it. So that's why I think the expander is a really good idea, because your muscle, basically you're training your muscle to hold up all that weight, and it forms your skin and the muscle to the shape of the implant, so it looks more natural, if you guys know what I mean. So that's basically what I'm going to be getting done on November 4th, is they're going to remove my breast tissue, put in the expander, and then I'm going to go, for a couple months getting these things filled. I'll give you guys a update and everything like that throughout my process after surgery and all that stuff, just to keep you updated, because it is a long process. They said it's about 6 months for the whole healing process for both surgeries to happen. So yeah, it's no joke. This is when they say you really have to be mature to make this decision. It's not just a minor surgery in and out. It's a big deal. So after a couple months, I have the expanders in. Then those obviously have to come out, and then I get the actual implants in. Now I do have some pictures here because they just came out with a new implant. The brand is Naturel, and it's called the Gummy Bear implant. Now, I know with me, when I think of a breast implant, I think of this. You know, clear, this is what you usually see on TV, squishy, soft, you know, round. This is what I think of. I believe this is silicone. I know there's some they fill with saline as well, but don't quote me, but I think they just went to silicone, but I'm not sure. But this is what I think of when I see a implant. Well, the Gummy Bear implant is totally different. It has a different texture, it's more firm, and it's more natural looking. It has a teardrop sort of shape to it. And this is the implant that I'm going to get. So you can see that this part here, right here, is up against my chest wall. And then the muscle is over this part. And you can see how it's flat, 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 and then it comes out a little to make that natural breast shape. So this is the implant that I'm going to be getting. It was just FDA approved. These are supposed to be awesome. I know the surgeon was really happy and is recommending patients who have these to eventually switch over to these, because these are really great. What I like about these is when I look at this, I think of what if this pops? What if it leaks? I'm in big trouble. But with this by Naturel, why it's called the Gummy Bear implant, is what happens when you bite into a gummy bear? Nothing. It's that thick, cohesive center. And nothing leaks, nothing, you know, drains or anything like that. So I actually have a picture of a Naturel round implant, and they actually cut into it, and the center is that thick, cohesive material. So if I have a leak, if it somewhat tears, God forbid, I don't know how it would, but this just makes me feel a lot better because there is no liquid inside these. Yes, there's a big difference. I have a picture here with them side by side. This one is more squishy, more round, you know, more soft. These ones here, the Gummy Bear implants, they do have a more firm feel to them, but they are supposed to look more natural. I know my plastic surgeon said that if you compare these, this is actually a really good picture, I like it. If you have these implants, see how wrinkled they are, and they're just sitting flat. A lot of people with these implants right here, when they have them in, you can see the rippling and the wrinkling through the skin. So this Naturel Gummy Bear implant is all smooth, and it has that thick, cohesive center. So even if it drops or if it's tight on your skin, you're going to have minimal wrinkling, and it's going to look as natural as possible. And that's what I want. I don't want it to look like I have, you know, fake breasts. I don't. I want it to look as natural as possible. So she recommended the Gummy Bear implant. I think it's a great idea. So the implants go in after I am healed from the expanders. They go in and cut the same exact incision line that they did with the first surgery, and they go and they take out the expander, and they just replace the implant with, that's the same size of the expander that has been expanded, with the same amount of saline in it, is the same size as this. So the expander is going to be this, or not in my case, but let's say for example, the expander is going to be this big. So even if you take the expander out and then you put the implant in, the body's not going to know the difference because it's strong, it's healed, and it's stretched to hold this implant. And that recovery time, I believe, is not even a week. I believe my mother said when she got her implants in, she had it done on a Friday and she was back to work on Monday. Pretty easy. So I think that's about it. That's all the pictures I have. I hope that was helpful for you guys. But I will, do more. I probably won't post any more videos, or not as often as I am now, just because of my schoolwork and everything, and I have tests and all that great stuff. So if you guys have any questions, feel free, like I said, to comment me and message me on Facebook. I'm constantly checking my phone. I want to be here to help you guys and give you as much detail and information as I can. And like I said, I'm not ashamed. I'm not going to be embarrassed about this. It's a learning process, and I want everyone, especially young women out there, to be aware. I know a couple people have come up to me and told me stories about girls who ended up getting breast cancer and they didn't even know what the gene was, and they wish they got tested sooner. And another one of my friends were talking to a group of young girls, and they didn't even, telling them about my situation, and they didn't even know what a BRCA gene was. So this is why this is so important to me. If you do have a family history of breast cancer, I totally recommend you guys getting tested and figuring out what your chances are of getting cancer and possibly preventing it by whichever option you choose in the future. So again, thank you guys so much for sharing the t-shirts and buying t-shirts. Get the word out there. This is going to be so helpful, and I hope, like I said before, this video helps. So I will talk to you guys soon, and I'll come back with updates as I go. I'll talk to you guys before my surgery, and I will go and show you guys, like, during my surgery, the healing process and all that. So videos to come of the real deal. I'll see you guys later. Bye.